All right, so our agenda for today is we'll look at a couple statistics, some illnesses and injuries that are caused by heat stress, prevention, a couple tools that you can use, and then we'll wrap it up. All right, so heat-related injuries cause thousands of worker illnesses each year. Heat is the number one weather killer in the United States. It averages about 120 deaths a year. And in North Carolina, South Carolina, Tennessee, Virginia, and Georgia, in 2017, the total number of heat-related illnesses and injuries was 580 that were reported. All right, so the generation of body heat. So there is metabolic heat, which is the heat generated through the digestion of food, work, and exercise. And there's also environmental heat, which is heat that the body absorbs from the surrounding environment. So the body's cooling system. As the body's core temperature increases, several activities increase as well. So your sweating, heart rate, and the blood flow to the skin. And when the body's cooling system works as it should, the core temperature drops and can stabilize itself at a safe level. So how does heat stress occur? During warm weather, the body normally cools itself by perspiring. When the air temperature is the same or warmer than the body temperature, cooling the body is more difficult. So when the humidity becomes higher, perspiration will not evaporate as quickly, thus preventing the body from releasing heat as fast as it normally would, causing various levels of heat stress. So some personal risk factors for heat stress injuries: obesity, diabetes, high blood pressure, heart disease, having a sedentary lifestyle, certain medications, diuretics like water pills, psychiatric medications like lithium, blood pressure medications. Sometimes these medications will result in a worker's inability to feel heat conditions, or it doesn't allow them to sweat. And also some medications will cause you to sweat a lot more. Alcohol consumption and illicit drug use like opioids, methamphetamine, and cocaine. So there are the types of heat injuries and illnesses that we're going to be talking about. So as we go down through this list, the ones at the top are more mild, and at the bottom we have the more dangerous. So you have heat rash, heat cramps, heat syncope, heat exhaustion, and heat stroke. So for heat rash, the symptoms are red cluster of pimples or small blisters. It can happen anywhere on the body, but mostly it'll be on your neck, or your back, or your groin area. First aid for this is to try to work in a cooler place if possible. If you do develop the rash, you want to keep the area dry. You can use powders to help keep it dry as well. Heat cramps. The symptoms include muscle pain or spasms, usually in the abdomen, arms, or legs. First aid is you want to stop all activity and sit in a cool place. Drink lots of water or clear juice, or Gatorade, body armor, those type of things that are going to help to try to get you hydrated. You don't want to return to strenuous work for a few hours after the cramps subside, because these are kind of the first signs of heat exhaustion. So you want to make sure that you rest up a little while, try to hydrate yourself, because we don't want to go into heat exhaustion or potentially have a heat stroke. Seek medical attention if any of the following things apply: if the worker does have heart problems, if the worker is on a low sodium diet, and if the cramps do not subside within 1 hour. Affected workers with heat cramps are typically ones that do a lot of sweating during strenuous activity. All right, heat syncope. So these are the symptoms: are fainting, feeling dizzy, being lightheaded. Treatment is you want to lay the worker down in a cool place until the symptoms fade. Slowly drink water, clear juice, or a sports beverage. Heat syncope is a fainting episode or dizziness that usually occurs due to prolonged standing or sudden rising from a sitting or lying position. Factors that can contribute to heat syncope include being dehydrated or not being acclimated to the temperatures that you're working in. All right, so heat exhaustion. This is one of the more severe illnesses or injuries. So heat exhaustion is the body's response to an excessive loss of the water and salt, usually through excessive sweating. Workers most prone to heat exhaustion are those that are elderly, have high blood pressure, and those working obviously in hot environments. So heat exhaustion is considered a medical emergency. So the signs and symptoms are weakness, heavy sweating, pale or flushed complexion, muscle cramps, extreme weakness or fatigue, slightly elevated body temperatures, dizziness, fast and shallow breathing, and also nausea. Treatment for heat exhaustion is you want to have the worker lie down in a cool, shaded area, or if you can get them into an air-conditioned area, you want to call 911 and notify the supervisor. You want to have them drink plenty of water. Obviously, you don't want to have them drink an alcoholic beverage. You want to cool them with ice, cold towels, or if it's possible, put them into an ice bath. The next most serious condition is a heat stroke. It occurs when the body becomes unable to control its temperature. The body's temperature rises rapidly, the sweating mechanism fails, and your body cannot cool itself down. So when heat stroke occurs, the body temperature can rise to 106 degrees Fahrenheit or even higher within 10 to 15 minutes. So heat stroke, it can cause death or permanent disability if emergency treatment is not given. So some of the signs and symptoms of a heat stroke: hot, dry skin, or profuse sweating. A lot of times somebody would be sweating like crazy and all of a sudden it stops and they begin to look like they have a bad sunburn. If somebody's hallucinating, if they're having chills and it's very hot outside, a throbbing headache, high body temperature, if they're confused or they're dizzy, and if they have slurred speech. So management should also be cognizant when interacting with workers. So when you're on site, you want to watch their body language and look for things like them dropping tools, being disoriented, phasing out, and staring into space. When you're speaking with them over the phone, you want to be aware if they're able to concentrate on the conversation, and also if they're not responding appropriately to some of the questions that you're asking. You can kind of tell just through a phone conversation if somebody is experiencing symptoms of heat exhaustion or heat stroke. Workers, like I said earlier, workers may have been sweating profusely, but now they're dry looking. It just looks like they have a bad sunburn, and it's not normal to be sweating and then all of a sudden stop and have a dry body. So the treatment for a heat stroke: definitely need to call 911 and notify your supervisor. You want to move the sick worker to a cool shaded area, and you want to remove outer layers of clothing to help cool them off. And you can cool them off using some of these methods. You can soak their clothes with water. You can spray them, sponge them off, shower with water. And you can also fan their body to try to help cool them down. All right, some heat stress prevention ideas. Modifying work schedules so that workers are out of the sun during the hottest time of the day. It's not always possible, but on extremely hot days, typically we see those coming. Trying to start them out earlier in the day, also it helps a lot. Arrange frequent rest periods with water in a shaded or air-conditioned area. Providing water to workers close to where they're working as well, so that they're not taking a 15-minute break every 2 hours, but if they need to get a drink, allowing them to quickly get a drink and cool off a little bit. And also routinely checking on workers who are at risk. So the risk factors, obese workers, workers on medications, workers that have heart disease, those type of things. You typically know who those are, so making sure that those workers are okay is a good idea. Developing an acclimatization program that allows workers to gradually adapt to the heat by slowly increasing their workload. This should not just apply to new workers, but also should be applied to workers who have been out away from work for a week or more if they've been on vacation. As the season starts to heat up, I think we're there right now. But if you're hiring new workers that are, they might have worked in an office and now they're working outside, you need to let their bodies adapt to the change in environment so that they don't have any of these illnesses. Allowing these, your new workers coming back from work to take more frequent breaks and ensure they are staying hydrated. And seasonal changes should also be addressed for current workers when the weather starts to warm up. So new workers that have been away for a while, we need to make sure that they are becoming used to the heat and the temperatures that they're working in. Almost half of heat-related deaths occur on a worker's first day on the job. And we're not talking about thousands. It's usually a little over 100 every year. And over 70% of heat-related deaths occur during a worker's first week. So by not acclimating them to the temperatures, you're putting them at risk for having heat exhaustion or possibly having a heat stroke. All right, so training employees. Organizations should use the information in their heat illness control program. So to train supervisors and workers. Trainings should include information regarding the following: how heat illnesses develop, heat illness risk factors in your workplace, how to prevent heat illnesses, the importance of drinking small quantities of water often, the importance of workers becoming acclimated to the temperatures, reporting signs of heat-related illnesses to supervisors immediately, and the procedures to ensure that directions to the work site can be clearly provided to emergency medical services. This is probably something that you're already doing for your job sites, but making sure that workers and medical personnel can get to the scene if there is an incident is very important. All right, so employees and their supervisors should know how to spot signs of heat illness in themselves and their coworkers. This type of education is critical when it comes to providing timely treatment to those who need it. All right, PPE. So there's different things you utilize, and we don't see it very often probably here in North Carolina, but if you're working in Texas, those environments, they have things like body cooling vests, water cooled garments, and personal cooling systems. If you are using these things, they should be selected very carefully, and they do need to be washed daily. So they can become very expensive, but if you do have at-risk workers that need these things, it is something good to look into. PPE should also be made of woven, breathable materials. So you're looking at your high-vis vests. Typically, those are type of a mesh woven material. So you want to make sure you're not putting something heavy weight on them. Wide brim hats help protect workers from direct sunlight. And you always want to have them try to dress in lightweight, light colored clothing because it does reflect the heat and sunlight. All right, so know these couple terms. A heat wave. It's a prolonged period of excessive heat, often combined with excessive humidity. And the heat index, a number in degrees Fahrenheit that tells you how hot it feels when relative humidity is added to the air temperature. Exposure to full sunshine can increase the heat index by 15 degrees. So when we talk about the heat index, we're combining the two. And I've got a pretty good little chart that kind of shows you where that's going to be at coming up. All right, so the heat index is the level of external heat affecting workers. It's often related to the surrounding air temperature, the amount of air movement, and sources of radiant heat. Radiant heat doesn't just come from the sun. It can come from obviously heaters, boilers, fires, equipment, and then also the sun. So in terms of protecting outdoor workers, you might want to consider limiting or halting work if one or more of the following is true. The temperatures begin to rise to dangerous levels, and we'll look at that chart coming up. The humidity increases to extreme levels. Heat from the sun begins to intensify. There is an absence of air movement. Proper controls are not in place to reduce the impact of radiant heat. And the work if the work becomes too strenuous for the conditions, have your workers do something else until either the sun goes behind the buildings or that you can get some relief from the heat outside. The heat index, which takes into account both temperature and humidity, should be used as an indicator for employers to determine if the air temperature and humidity are safe to work outdoors. So it is something you should be monitoring, especially during these summer months. And this is the NOAA's National Weather Service Heat Index. So on the left-hand side, you have the relative humidity, and on the right hand, or on the top line, we've got the heat, the temperature. So when you combine those together, you get the heat index. I've circled when the temperature is 96 degrees outside, which is common here in July, June, and August around the Charlotte area and probably all over North Carolina. The heat index is going to be 126 degrees. So when you have 96 degree temperature and you have a 70% relative humidity, it's like the real field temperature is 126 degrees, and that is extremely dangerous. As you can see, all of the red on the far right, the red marked part of the chart, that's very dangerous. Top left, where you have the yellow, that is, you know, kind of a more mild atmosphere. All right, so when your heat index is less than 91 degrees, like I said, in the yellow, the risk level is lower. So you need to use some caution. But when it gets to 103 degrees to 115 degrees, the risk level is very high. You need to take additional precautions, making sure that you're providing lots of water, you're providing breaks for your employees so that we don't start, you know, from the heat rash, heat cramps, and eventually somebody having a heat stroke. So OSHA and NIOSH have a very good safety tool for measuring the heat index. It is a very useful resource for planning outdoor work activities based on how it feels throughout the day. So it features real-time heat index and hourly forecasts, and it is specific to your location. So you can tell exactly what the real field and the heat index is where you're at. You can also change the locations if you have multiple work sites, just to see, you know, what those conditions are like in different areas. It features a visual indicator of the current heat index and associated risk levels specific to your current geographical location. It also gives precautionary recommendations specific to heat index associated risk levels. It has an interactive hourly forecast of heat index values, the risk level, and recommendations. It has an editable location, and it also will show, it'll list the signs and symptoms and the first aid procedures to treat heat-related illnesses. So this is what, on the left-hand side, if you open up the app, this is what it looks like. You can see that we have the temperature is 95 degrees. The relative humidity is 55 degrees. So it's a real feel of 109 degrees. And this is a high risk area, and precautions need to be taken. So you can see on the bottom, it'll show you the first aid, symptoms, and it'll also give you an hourly real feel forecast for what it's supposed to be. If you do download this app for your iPhone, the iTunes Store, or Android, this on the right-hand side, that sun, that's what the app is going to look like. So if you're looking to download this, that's kind of the sign that you're looking for. And if you type in the OSHA NIOSH heat safety tool, it pops up pretty quick. And it's actually something that's very good. And if you weren't aware, NIOSH is the research arm of OSHA. So they do, they're looking at lots and lots of data. They're looking at how they can help out with the data that they're using. All right, so to wrap it up, heat kills by pushing the human body beyond its limits. In extreme heat and high humidity, evaporation is slowed, and the body must work extra hard to maintain a normal temperature. Employees and supervisors should be trained and know the signs of heat-related illnesses and injuries. Acclimating workers to outdoor temperatures they may not ordinarily be used to is one of the best ways to prevent heat injuries. And monitoring the heat index and trying to assign the workload accordingly, doing some of the hardest work maybe in the morning, to leading up as the day gets hotter, doing some of the lighter stuff if at all possible. And also remember the three: water, rest, and shade. So you want your employees to start drinking water at the beginning of the day, drinking lots of water throughout the day. You also want to have them rest, let them take some breaks. And when they're doing this, have them sit in the shade. So my name is Michael Williams, and I am the loss control consultant for Relation Insurance. If you have any questions, you can reach out to me by email or by phone, or you can also reach out to your producer if you're looking for any other resources that, concerning this or any other safety resources. I'd be more than happy to help you. So thanks for being with me today, and we'll see you next week.